Hello and welcome. Welcome to this recorded session at the IM4US 2022 conference. I am Megan Kingsley Gale. I volunteer as director of the Hospital Handbook Project, and today I'm bringing you a presentation from the Hospital Handbook Project's Safety and Practice Workgroup. Today's session is called Speaking the Language of Safety in HRO Systems as Acupuncturists, Cultural Competence, Recognizing the Language of Safety, and How It Applies for Those New to Working in the U.S. Healthcare System Setting. As I mentioned, I volunteer as director of the Hospital Handbook Project for acupuncturists and their hospital sponsors. The Hospital Handbook Project is the nonprofit collaborative learning network for healthcare system-based acupuncturists and program managers. It is the home of the healthcare system-based acupuncturist professional community network. So thank you for being here today. I am looking forward to your feedback. So just to, kind of start out, there's a little bit of housekeeping here. I'm trying to keep this into just 60 minutes. So I might go briefly over some things and then spend more time on other things. So if you have questions for me during the live IM4US virtual conference, I will be attending the conference while it is live. So you can message me in the conference app while the conference is going October 6th through 8th. But after the conference, the best way to reach me is through the Hospital Handbook Project's website contact page. If you are taking this for continuing education credits, I do have several slides that kind of help guide you through those. So I have a pre-quiz slide that brings up the CEU questions, and then I will point out some of the slides that have the answers to that questions as we go through this. All right, so just a little outline about what to expect from this session. I'm going to go through like an overview of the objectives and some pain points, like why you might be interested in this, who this session is for, who might benefit from this. I'll introduce you to the Hospital Handbook Project, and specifically I'll introduce you to, beyond that, I will introduce you to our Safety and Practice Work Group. We'll have that pre-quiz that introduces those CEU questions. And then I'm going to go dive into what is safety in the healthcare system setting, how to recognize ideas around safety and terms used. Talk about, what is a safe, positive environment and what do structures of safety look like, and give you some examples. I'll introduce the 4 categories of safety and the 7 major topics that we've identified so far. And I'll talk about some specialty populations and settings that the work group has identified. And then the end slides will have more about where to find resources on these topics. So you may be wondering, well, why listen to this talk? What am I going to get out of this? Who might this be helpful for? Well, it might be useful for anyone who is a provider or profession who's new to working in healthcare system-based practice, or like an entire profession that may be new, such as acupuncturists and massage therapists, as well as what I've heard as we've done other presentations from the Safety and Practice Work Group is that this information is really useful for our safety leads and our program managers who work with integrative health professionals. And I highly recommend this presentation for all acupuncturists, whether you're working in clinical practice, working in healthcare system-based practice, or interested in working in that system, in any part of the system, whether it's urban hospital, academic medical center, county clinic, rural setting, federal practice. So federal practice settings include our VA, in the DoD, it's the military health system, Indian health system, etc. So the Safety and Practice Work Group's work the goal of it is to improve our colleagues' communication on safety for acupuncturists working in the healthcare system setting. So some ways that the work group is doing this work, what we do to get this information to colleagues is what we already have available at the Hospital Handbook Project, and it is ongoing, our asynchronous discussion sessions, where there's an article about a specific safety thing and then discussion thread connected to that article, or questions that come up and discussion threads get tied into that question that came up. That's all available on our discussion platform. Then we have public presentations. such as today's presentation at this conference. And then the work group is also developing a reference document that when it's finished, the goal is for that to be able to be, someone could purchase that from our website store. So this session today is it's only 60 minutes. So there's only so much we can get into, but we are going to get into a few things. So we're going to introduce you to the work group and its work. And we'll also introduce you to the 4 broad categories of safety in healthcare system-based practice and the 7 main topics of safety as related to acupuncturists working in this environment that the work group has already identified. So some objectives for today's session. One is to identify those 4 broad categories of safety and practice for healthcare system-based acupuncturists. And I'll just tell you the 4 broad categories right now is quality assurance, quality improvement processes, workplace safety, and patient safety. Number 2 is to recognize and list the 7 overarching safety topics identified by the work group. And number 3, my hope for you from listening to today's session is that even just being exposed to these categories and these lists and some of these ideas that I present, that you'll be able to start identifying these safety standards in your own practice, in your workplace, and be able to recognize their importance, such as being able to describe why you should learn and document, such as having a standard operating procedure, even just, minimum requirements and what structures might look like to be able to create a safe practice, a safe workspace. Be able to do even just a brief or very minimal assessment of your current safety practices, and to be able to connect to safety-related resources, including the work group's resources. And those resources are going to be on the end slides of today's presentation. So how is today's presentation supporting the IM4US 2022 conference theme, Decolonizing Medicine, Centering, and Rebuilding Grounded Approaches to Healthcare? The Hospital Handbook Project's mission is to support the option of healthcare system-based employment for acupuncturists. Working in the system requires unique cultural competencies and code switching to be accepted by the current U.S. healthcare system culture. Whether acupuncturists work in county clinics, federally qualifying health centers, or safety net hospitals, whether inpatient setting or outpatient setting, all these workplace settings, they share the common language of safety and accountability. Cultural integration. To work in the healthcare system in the US, you need to understand how the system values safety and accountability, and how the principles of safety, accountability, transparency, quality assurance, and quality improvement processes apply to acupuncturist practice in the system. This knowledge about modern US healthcare culture helps us culturally transition our work into mainstream healthcare. So knowing the language and the standards around safety is a good foundation for working within the system. So knowing the language and standards around safety is a good foundation for working within the system, and over time, like over years, building out programs and service lines. The language of safety, accountability, and transparency are common throughout all healthcare systems, from FQHCs and county clinics to our safety net hospitals and academic medical centers. There is a new trend in the last few years in the US healthcare system setting for the high reliability or HRO model. Understanding the basics of this model and how it translates to an acupuncturist practice in the healthcare system setting is essential to be able to successfully work within the system now and in the future. This is the new model that's being adopted by many healthcare systems. The resources created by healthcare system acupuncturists collaborating with the Hospital Handbook Project Safety in Practice Workgroup are essential and unique. So I will introduce you to the workgroup members, but please know that they're not the only people who are working on this. They are the dedicated workgroup members who are spending the most amount of time on this, but they receive information from the community and from leaders in different parts of the community who work specifically on safety things. So this set of resources that the work group is creating may be the first of their kind for acupuncture and acupuncturists in a healthcare system-based practice setting. Pretty cool, huh? You guys get to see some of this for the first time today, probably. So this is only our second presentation, our public presentation about the resources we've been putting together for the past year. So some pain points, why this is important. Safety language and safety culture. So in the US healthcare system, so cultural competency and safety culture, policies, procedures, checklists, etc., in healthcare system-based practice. So over the years, colleagues, acupuncturists have reported that they struggle to communicate their safety practices when questioned about it. That doesn't mean that they're not doing it. It just means they don't have the language to speak about it. They are doing it. They know they're doing it. They're doing it throughout the day, every day. It's inherently part of their work. So at the Hospital Handbook Project, we've been building resources specific to communicating about safety as related to healthcare system-based work. We started out, several years ago with just internal articles like sharing, the Joint Commission safety event number such and such, and that's what this means, and these are the resources around that, and these are possibly, some standard operating procedures that you can adapt that are based on that, or, needle accountability policy. And then, just in our throughout all the resources in the discussion space. And then in 2020, per community request, we moved a lot of those standalone articles into a standalone online resource, so collecting all of the safety resources together. That online resource is for Tier 2 subscription members. It's called the Joint Commission and Other Quality Assurance Standards for Hospital Acupuncturists and their admin. And then we have several online resources, but one of the other online resources that we have for Tier 1 and Tier 2 for a standalone resource is also for Tier 2 subscribers. And then Tier 1 members also have like a discount to it. So it's available to in a lot of different ways. It's called the new hospital employee. So so the new hospital employee is an online resource, can be accessed separately. And I had added over the years a few safety things specific that new hospital employees are often asking about. So one of those is the needle accountability policy form, and that's usually like, lost needle, drop needle, what to do in the case of those things. And then in May of 2021, I hosted a live presentation plus community discussion specifically about the peer record review process for acupuncturists. So that recording is also available. And then in late 2021, about November, we started the dedicated safety and practice work group. And that was set up, and doing a work group takes a lot more resources, time, and as well as money because of that dedicated time and space. So the community decided that it was worth it to set this up as a separate work group with volunteers working specifically just on resources. But this was the time, the year 2022 was the time to really, do more with what we've, and then more with building out communication resources, such as today's presentation. So I dedicated specific virtual synchronous and asynchronous discussion space for this work group specifically to focus on safety practices communication. So when you or your profession is new to the system, so this is one of those pain points, when you're new to the system, and this goes to cultural competency around safety, when you're new to the system, there's like 3 different ways that you're can approach safety, or that you become aware of safety. So there are things that you inherently do already to keep your patients safe and for those patients to have positive outcomes. That's the inherent stuff. And then things that you learn because your workplace has required you to learn them. They are workplace mandated. And then there are things you should do. So things that you inherently know. So these are things that you learned as part of your education. So as acupuncturists, you learn them as part of your education. You practice them every time you see the patient, So you're doing it multiple times a day, every day, weeks on end, years on end. And so you do it so much, it just becomes inherent and you don't necessarily think of it as specific SOP, standard operating procedures or policies. You're just inherently doing those things. And that's often, for acupuncturists, it's often clean needle technique and everything that goes into clean needle technique, and sometimes also trauma-informed care. Then there are things that you learn because the workplace has required you to learn them. These things are not yet inherent. They're not yet something that you just incorporate as part of your normal daily routine. And some of these things, such as, cybersecurity training or trainings that only happen once a year, they may never become inherent. You may always need extra reminders, not just simple reminders, but bigger reminders. And then there are things you should do. These are things that are not mandated by work, but they feel right. And the reason they feel right could be various. Could be based on your workplace guidelines, or maybe you have a really positive culture of safety at your workplace, but there isn't a specific rule about this particular situation. Or maybe it feels right because of other training you've had or other ethics considerations. So for things like that, where it's not required by work that you should do that, but it seems like a good thing, you need to know who your resources are to talk about that gray area or that new area. Maybe it's a new safety thing that should be happening, but isn't happening now. So, know who your safety and ethics go-to resources are, such as a safety officer, ethics officer, legal counsel, chaplain service, etc. So safety language and safety culture in the U.S. healthcare system. So my goals of telling you about this today is, first, I want you to become aware of what you already do around safety, and then develop awareness of what you need to learn or review as you're being introduced to these categories of safety and topics in safety. And some of the things and ways of looking at safety. So what safety can look like briefly, this is not an exhaustive list, just different ways that safety can look. It can look like checklists, like standard operating procedures, like documentation. It can look like after action reviews. It can look like workplace training, such as workplace training in cybersecurity. So today's presentation is Speaking the Language of Safety in HRO Systems as LACs at the IM4US conference. We do have other presentations on this topic. We had one in September, hosted by the Hospital Handbook Project, and one that's coming up in November. And you guys are welcome to check out those links. So these slides will be available as a PDF near where this video is posted, and you can follow these links. You can go to the PDF and go to the slides and follow the links, these hyperlinks, to be able to get more information. But so today's session is just 60 minutes, or as close to 60 minutes as I can, get this down to, and I'm doing my best. But the September and November sessions are actually 2 hours, or sometimes even a little more than 2 hours, and they're set up as a presentation plus community discussion session, and they're a little bit different than today, but they are both presenting the information from the Safety and Practice work group. For our November presentation, I will be co-presenting with Paul McGee, who is the outpatient program lead at Allina Health System in Minnesota. So here's my speaker slide for IM4US. I am Megan Kingsley Gale. I volunteer as director of the Hospital Handbook Project for Acupuncturists and their hospital sponsors. I have worked in hospital-based practice in the past, and because of my past hospital-based practice experience, and then the short story is that my husband is active duty military, so we move around a lot. I left that job because of being able to support his work. And so what I learned at that job is that I really would have been helpful if a resource had existed where that connected me, so I could to other acupuncturists working in other healthcare systems. That could be like, hey, how do you write a SOP for this? Can you share an example? Or, we're going to start up a new program on this. I see you guys already have that. Can you tell me more about that? And maybe what more about metrics that you collected? But that resource didn't exist at that time. And so slowly but surely, I started creating that resource. And that resource is now called the Hospital Handbook Project. So I've been creating it as a unique nonprofit community resource project since 2015. And some of our big news is that this past year in January of 2022, we joined a 501c3 nonprofit, and I'm continuing to volunteer at the Hospital Handbook Project as its director. So if you want to learn more about the origin story of the Hospital Handbook Project, you can check out that geological conversation link for the origin story. So briefly here, in 10 minutes or less, what is the Hospital Handbook Project? So the full name of the Hospital Handbook Project is the Hospital Handbook Project for Acupuncturists and their hospital sponsors. It is a living community resource. We have virtual discussion space and deep dive online resources. It is a community of healthcare system-based acupuncturists, program managers, and admin. We also connect with researchers, so researchers who want to work with some of these programs, be able to connect them to each other, programs that want to work with researchers, and we also have resources for students, prospective practitioners, and educators. Those resources for them we call our First Steps resources, and we are a 501c3 nonprofit. We have that status. Our vision. The Hospital Handbook Project is the go-to resource for hospital and healthcare system-based acupuncture work, employment practices, and program standards. We are a professional network community of hospital and healthcare system-based practice acupuncturists, clinicians, program managers, researchers, and more. So this quote that is often attributed to Ralph Waldo Emerson, "Do not follow where the path may lead. Go instead where there is no path and leave a trail." Acupuncturists have been working in healthcare system-based practice for a long time. At the Hospital Handbook Project, we have been successful in connecting people who've been working there a long time to people who are kind of been there, 10 years or less, to those who are just starting out. So we can help each other kind of grow and share this wisdom instead of working in silos. So the most important part of what we do, the most important part of our vision, is to be able to support healthcare organization employment to be available as an employment option for acupuncturists. And I mentioned before, we are a professional networking resource, and we share ideas and solutions together. So to be clear on language, when I say hospital-based or healthcare system-based or hospital and healthcare system-based, I'm using a really broad definition of that. I mean working in a facility or organization that is accredited by or eligible for accreditation by the Joint Commission. The Joint Commission is a nonprofit quality assurance and safety vetting organization that's based in the US. It accredits a variety of organizations, including hospitals, ambulatory centers, county clinics, federally qualifying health centers, federal facilities, the military health system, the VA, and some hospice organizations. At the Hospital Handbook Project, our goal is to help each other avoid reinventing the wheel by having discussions, identifying issues, sharing solutions, and growing together. We are a nonprofit, not-for-profit community resource. We have and are developing, so we have resources, and then we're always adding to resources or going back and editing resources for the following 4 types of users who come to the Hospital Handbook Project. The students and prospective practitioners mentioned, we call that set of resources our First Steps resource. Healthcare system-based acupuncturists, our leads and program managers, and our hospital admin. So this is just a sampling of the discussions that we've had in the past, and many of them that we continue to have. I'm just going to draw your attention to the inpatient acupuncture program. We have an inpatient acupuncture discussion group, and we are kind of bringing together all those resources, and we're getting this season, we're putting together a virtual conference specific for inpatient acupuncture for January 2023. When you're looking at the PDF of the slides, you can follow that link to learn more. We have resources on safety and practice, such as today's presentation, and we have a bunch of resources and discussions on documentation standards. So our current work in 2022. So our goals for this year have been to improve current resources, encourage best practices in hiring and employment for a profession in this setting, and leadership development. We're a nonprofit, so we're always needing to raise funds so that we can exist, so that we can continue to do this work. Our ongoing work includes the Issues in Hospital-Based Practice webinar series and the community discussion platform. Early on in 2022, we decided to dedicate space specific for 3 work groups. The Safety and Practice work group, and today is the second public presentation from that work group. Our employment practices for hospital and healthcare system-based acupuncturists, that work group. That work group also supports our data survey project. We had a public presentation from that group in June, and so the recording for that is now available. And that presentation talked about minimum requirements on how to hire and credential acupuncturists in the healthcare system, with focus on revenue capture and clinician retention. So if you're interested in getting started with that kind of thing, I highly recommend that recording. We also have our inpatient acupuncture program discussion group, and I mentioned we are gearing up for the conference, which is going to be in January. I'm also often asked questions about what do I recommend for the students and prospective practitioners. These are the things that I recommend. We have one thing available on the website, the workbook plus the ebook plus workbook called Getting Your Foot in the Door, First Steps. And then we also have our Tier 1 discussion platform. And in the Tier 1, you also have access to that ebook and workbook and a few other things. And there are standalone resources that are also useful for students and prospective practitioners. The Tier 2 discussion platform, this is a list of some of the things that are available to our Tier 2 subscribers. There's actually more than this available. This is just a lot of them. It's not all of them. There is more resources, and we're always always getting more stuff added to that. Tier 2 discussion platform is specifically for healthcare system-based acupuncturists and program managers. So how to support this work? So we believe at the Hospital Handbook Project that healthcare system-based practice is an option for licensed acupuncturists. So we want to grow and improve this option for prospective and future practitioners, for people who are currently in practice, as well as those who will be in practice in the future. So that's our current students and future students as well. The Hospital Handbook Project helps communicate what the best practices in this setting are. The best practices include hiring and credentialing acupuncturists, professional practice evaluations specific to acupuncturists, program standards, clinical metrics, and knowledge, skills, and abilities for general practice and specialty practice settings. Because working in the established healthcare system means that patients can access care where they're already receiving care. So back to safety. Speaking the language of safety in high reliability systems as acupuncturists. So the goal here for today's presentation is being able to recognize some of these safety ideas and safety language. So speaking of language, I'm going to start out with some abbreviations and definitions. So I'm assuming not everyone who's watching this is going to be an acupuncturist. So I'm going to go through some of these terms, and then so I'll start with the acupuncturist term, and then some of these other terms I'm using a lot throughout the presentation. Their acronyms or abbreviations are up on the slides, and sometimes I say the whole name and sometimes I just use the acronym or abbreviation. So I wanted to make sure I told you what I meant when I'm using these so it's more clear. And this is slide 25. So LAC refers to licensed acupuncturist. This is the state license title for anyone who's graduated from a master's or doctorate degree program from an ACAHM accredited program. ACAHM is the Accreditation Commission for Acupuncture and Herbal Medicine. It is a specialized accrediting agency recognized by the U.S. Department of Education. BLS SOC, that's the U.S. Department of Labor, Bureau of Labor and Statistics. So BLS is Bureau of Labor and Statistics. SOC refers to Standard Occupational Code. So a profession that is determined as unique from other professions is given an SOC. This is a number that the BLS uses in their data tracking for the profession. Excuse me. This is a number the BLS uses in their data tracking for the profession. The SOC for acupuncturists is 291291. QA is quality assurance. QI is quality improvement. it usually refers to quality improvement processes. SOP, standard operating procedure. FPPE, OPPE refer to professional practice evaluation. This is a quality assurance standard and a quality improvement process for healthcare professionals. FPPE refers to focused professional practice evaluation. OPP refers to ongoing professional practice evaluation. So here we go. Get my slides working here. Right, today's session is to introduce you to the work group and its progress so far, be able to build language on the safety-related topics that you already engage in and those you may not have been aware of prior to this presentation. Maybe just review what the work group is, its goals and tasks, why resource work around safety in practice, QA and QI specific to acupuncturists is important, identifying the categories of topics and resources in safety, accountability, and transparency that affect or apply to acupuncturists working in the healthcare system-based practice, and how to find related resources at the Hospital Handbook Project. We do have more resources on this, and so what I'm not able to dive into today, so if you're interested in this small list below and the things related to this list, so it does get into a bigger list, we do have resources for that at the Hospital Handbook Project. We just don't have time to cover them today. We will not have time to cover safety as it relates to provider competence and communication, how this ties into professional practice standards, or translating acupuncture language into standard U.S. healthcare documentation, language, and standards. So what is the Hospital Handbook Project Safety and Practice Work Group? Well, it started in November 2021. The list of current and past members of full work group members are Christine Kaiser, who when she joined was the safety lead and program manager at UH Connor Integrative Health in Cleveland, Ohio. Paul McGee, who is the outpatient lead and manager at Allina Health in Minnesota, and myself. So our work group members, past members, current members, and future members, what do? So they look at safety, accountability, and transparency issues affecting acupuncturists working in healthcare system-based practice. So this includes quality assurance, those 4 categories: quality assurance, quality improvement processes, patient safety, and workplace safety. They identify so the big thing this year is just being able to identify what they are, what the categories are, what the topics are related, and then, tie in related resources that are essential to successful work in the healthcare system setting, and create resources. So doing all that work, and then once that work is identified and some of it's coming together, create resources for the community related to this topic-based work, and then communicate our progress in this work to the acupuncturist community, which is what we're doing in this session today. So if you're interested in volunteering on this work group, just send me a message via the website contact page. All right, so why is this resource work important? What's missing? There is a resource gap. So until this work group's work, there was only one major published national resource on safety standards for acupuncturists, the Clean Needle Technique Manual, which is great. This is a really great resource that we have in the U.S. It is used to train acupuncture students in the I think it's the first year of acupuncture school, and then you use it throughout your education. Then you continue to use it when you're out in practice. But what we found is that we need more than just the Clean Needle Technique Manual. And with the Clean Needle Technique Manual comes the Clean Needle Technique certification, which is required before you can even take your board exam. But what we found is in healthcare system-based practice, we need more than only the Clean Needle Technique Manual. We need a little bit more. So the community identified a gap in having more resources around acupuncture in Chinese herbal medicine, specific to the modern U.S. healthcare system setting. And the healthcare system and hospital setting, they have well-documented quality and safety measures for other aspects of care. And our community members have requested help in clearly communicating about safety, what their safety practices are, and how they use them. So what's a possible solution? What are some wisdom to draw from? Well, it turns out we have quite a few members of the community, the Hospital Handbook Project community, that are leaders in this session. I mentioned some of the work group members, there's safety leads and or managers. Those are the full work group members. We also have more people in the community that have worked in this setting. So we have a wonderful talent pool to pull from. So all I had to do was set aside space and time, which is, takes space and time, and virtual discussion space, is expensive and time and resources, but it was worth it to set that time and space aside this past year to have both asynchronous and synchronous discussion space for the work group members, and then connecting with the community asynchronously, and then being able to do these presentations that we are doing this fall to help get the word out. The work group for the community to work together to create an information, collection of information on this topic, and the collection of resources. The feedback so far has said that this collection of resources may very well be the first of its kind for acupuncturists in this setting. So at the Hospital Handbook Project, we are well positioned to develop quality material on this topic. We have the wisdom to draw from, we have the talent pool, and we have people who've been volunteering this past year and creating resources. And we have access to feedback from leaders in the healthcare system-based acupuncturist settings. So why is this resource work important? Well, I mentioned the HRO model. Yeah, so the pressure is on. We've got this HRO model. So I'm going to explain a little bit about what the HRO model is if you haven't already encountered this. So there is an increased focus on safety, accountability, transparency. You hear these three terms specifically with the HRO model. Increased focus on safety, accountability, and transparency in the new high reliability organization HRO model of healthcare. And there has been an increased emphasis on identifying and understanding these issues, how to develop processes around these issues that help you and your team improve over time. And, identifying and understanding these issues, developing processes, this is all part of a model that we encourage at the Hospital Handbook Project. That's the model of continuous learning and continuous improvement. What's unique about the HRO model, besides that safety, accountability, transparency, is that trio, safety, accountability, transparency, isn't considered enough. That has to be tied in specifically with two other things: leadership skills and your organization's culture. And it's not just, manager leadership skills, it's leadership skills on an individual level as well as different levels of the organization to have healthy leadership skills on both an individual and organizational level, and then tying that into culture. So you have to have a culture that supports being able to report things without repercussions, and a culture that supports accountability in a healthy way, not blaming someone for something, but being able to look at the system and develop a safe environment. So I'll get into that in a little bit. So what is safety? Let's talk a little bit about what it means. What is safety? All right, and this is that pre-quiz, the CEU questions that I mentioned I was going to say. So these are your CE continuing education questions for those of you watching this for CEU credit. What are the 4 broad categories related to safety in healthcare system-based practice? I've mentioned them already, actually. So that's the quality assurance, quality improvement processes, patient safety, and workplace safety. Then what list the 7, excuse me a moment. Okay, yep. List the 7 overarching safety topics identified by the work group and presented in this session. All right, and then where can you find more information on these topics? Spoiler alert, they're in the end slides. All right, so hopefully that helps you as we're going through this information, what information that you're looking for those CEU questions. So I mentioned I was going to talk about what creating a safe, positive environment means. What does it mean to, so another way of talking about that is, what does it mean to create an environment of safety? So safety, error, adverse events, and human performance factors. What do these things mean? Well, a safe environment means creating a space set up to minimize adverse events. So we need to know what are adverse events and what are near events. So I'll give an example from acupuncture practice. An adverse event is a needle stick accident. That's when a needle that's been in someone else, say the needle's been in John, it comes out of John, and instead of going into the sharps container, somehow it ends up in Anna. That's a needle stick accident. That's when, and the problem with why that's considered an adverse event is, first that wasn't the intended thing. You're not, no one intends for a needle that was in John to come out of John and then go into Anna. Anytime a needle comes out of someone, it goes into sharps container. That's what's supposed to happen. So the needle stick accident, where the needle goes not just on the floor and then gets picked up off the floor and put into the sharps container, the accident is when it goes from a dirty needle ends up in someone else. And so that means contagion has been brought into someone else's body. That's a needle stick accident. So what are near events? Near events is like when a needle is dropped or a needle like falls out, like say, sometimes the patient moves around and the needle falls out. And so it gets dropped and then you're like, oh, I can't find it immediately. But then you're like, oh, actually, there it is on the pillow. So you pick it up. And then that's no longer a lost needle or a dropped needle. It's now a found needle, and you put it in the sharps container. So a dropped or lost needle that's found is a near event. That's different than that needle stick accident that would be considered an adverse event. So how does this relate to environmental safety? So an environmental safety sets up checks and alarms that help adapt human behavior. This is a trick. That's part of that human performance thing. Because as humans, we make mistakes, we make errors. That's just part of being human. So an environment of safety helps to set up checks and alarms to help adapt human behavior toward a safe, positive environment. So I'll give you the example of the auto industry. So let's think about a car and driving a car and how cars have changed over the years. So the auto industry has made the assumption that humans, the drivers, are going to make mistakes. So how do you set up an environment that reminds the drivers to behave in a way that is a safe, positive environment, or helps them to what are some checks and alarms that you can put in the car to help adapt human behavior toward that safe, positive environment? Well, when you get in the car, if you forget to put your seatbelt on, what's one of the first things that happens? You get an audible alarm that alarms until you put your seatbelt on. And you might also get oftentimes you get a visual cue on your dashboard that shows a picture of like a person that has their seatbelt on, right? There's also in new cars, there's often something in the car that is noticing where the lines on the road are. So if you are veering off to over one of those lines, it'll help you redirect, or there'll be some alarm that you need to redirect. There's also the rumble tracks on the road. Distracted driving, to try to decrease the potential for distracted driving. Most cell phones now will notice when you're going faster than a walk, and they will put themselves in what they call driving mode, where only certain features of the phone are available, so that you're not easily, or hopefully less easily, distracted by your phone, and so that hopefully is cutting down on distracted driving. There's also assisted braking. So creating a safe environment for your clinic. So the goals are, let's talk about goals, how, and some examples. So the goals are to decrease adverse events and near events and be able to improve a safe working environment for your patients, for clinicians, and the organizations. So what are some ways that this can be done? We have to define your possible adverse events and then set up structures that help you decrease those adverse events and near events. So I'm going to give you some examples of, I gave you some examples of adverse event and near event. So I'm going to give you a few more. So adverse event, I had mentioned before, needle stick accident, also like a retained or stuck needle would be an adverse event. Patient fainting, a cyber attack on the clinic electronic health record system where protected health information is leaked. Or another adverse event example is an angry or distressed person comes into the waiting room with a weapon and is threatening patients and staff. A near event, as I mentioned in a previous slide, is that dropped needle or lost needle that is found before it gets stuck in someone else and is disposed of properly. So creating a safe environment, what are structures? So this is, part of this culture of safety, trying to understand what is meant when people talk about safety in the healthcare system-based practice. So the safe environment, you have structures set up. There are different structures that are related to each other that help each other create the safe, positive environment or an environment of safety. You have resources that help you define these structures and help you create the following kinds of structures: prevention structures that help you deal with the event itself; post-event structures; and again, prevention structures. So here's some examples of that. So resources are personnel training, like being trained on how to recognize a safety event or near event and what to do. Learning, like reading and knowing your standard operating procedures and where to find them, who to ask for help, who to report safety events to, and how to do that reporting. Prevention could look like standard operating procedures, personnel training, QA standards, and QI, quality improvement processes. Post-event structures might look like reporting, processing the event. So some ways events are processed are called, either after action review or root cause analysis. Nowadays, we're leaning more toward the after action review, which looking at the whole structure and systems and what went wrong in the system. Root cause analysis is still common in a lot of systems, but we're trying to move away from that because the way root cause analysis is set up, it often lends itself toward trying to blame one specific person or place the blame on something instead of learning how to make changes to create that safe, positive environment. Whereas the after action review is very much about systems. Learning from the event. So you have a QI process. Possibly you update your training and SOPs as appropriate. And prevention would be creating and improving the environment from learning from mistakes. So it's, part of that continuous learning, continuous improvement. So again, what do structures look like? Resources are written policies and other things. Prevention structures often relate to QA checks and quality improvement processes. And they can look like a lot of different things. So they can look like standard operating procedures, checklists, credentialing, peer record review, and training. Reporting structures can look like reporting process. Do you have a clear process about what defines a safety event or near event, what needs to be reported, and who to report to, and then how to do that report? So who could be your safety lead or direct manager, but you need to know your organizational structure and your reporting structure. For example, a lost needle that is found, a near event, is a different reporting process than a needle stick accident. A needle stick accident such as that happens to a clinician could be a clinician injury, or a clinician could be injured in a different way. That would be more related to the workers' comp set of processes, versus a patient getting injured, that goes into different processes, such as looking at provider competencies, one of the provider competencies is like peer record review, after action review type stuff. Management, it might have to do with your whole management structure. There could be legal issues involved and malpractice. But often you use multiple structures to create a safe, positive environment, an environment of safety. So it's usually a combination of the above structures and often all of them. I'm going to give an example of what structures look like using a needle accountability policy. So this is an example of a standard operating procedure called a needle accountability policy. And let's say in this example, this particular needle accountability policy includes the following. It's including a method for preventing lost needles, like having a needle count, for dealing with the event itself, for how to report it, and a quality improvement process for the manager. So the scope of this particular needle accountability policy in this example is going to cover drop needle, lost needle, retained stuck needle, and needle stick accident. The SOP includes references for where the standard came from. So definitely going to include the clean needle technique manual, but then it should also include your organization's policies on some of the following. This is not an exhaustive list. This is just to kind of get you an idea of what it would look like bloodborne pathogen training, sharps training, etc. The policy would define what it considers a near event versus what it considers an adverse event. The policy would create a structure for talking about preventing near events and adverse events. So, for example, that would be, documenting needle count. So documenting the needles that go in and the needles that get removed. And if that number is not the same, so if there are less needles than the needles that got put in, you do a needle check. You have a process for dealing with why those numbers are different. And the policy provides clarity about what to do in case of all those things that are in its scope. And then it has a structure for clinicians to deal with immediate near events that affect clinic flow. So there's a lost needle. So a needle fell out of, say, the patient's ear, and you're doing a double check around the patient. You find the needle on the pillow. Okay, now that's a found needle. Your needles in equal needles out. You've disposed of everything properly. Great, then you're done. Or let's say you've got that lost needle, you've checked the clothes and hair, haven't found it yet. You're checking the floor, so still haven't found it yet. So then, you hand the patient their shoes to put on before they get off the table. And then maybe they still haven't found it. The next level would be use a telescoping magnet over the floor and treatment table. And then the next level after that, checking linens. Next level, bring in a colleague or staff to help you double check and everything. And then if you still can't find the needle, you fill out your safety form and possibly even close the room until that needle is found. It really depends on what your policies are at your workplace. A possible QI, quality improvement process, would be a manager reviews reported near events and adverse events on a regular basis, whether that's monthly or quarterly. And the manager is just trying to note patterns. Are the events increasing? Are they decreasing? Why? Why? What can be done to help decrease events? Do we need to provide training on a regular basis to help reinforce whatever alarms have been in place? Do we need to do other things? So, maybe the providers have been seeing too many patients and are working too fast. So we know safety events increase when providers are overworked. So you have to kind of look into that. The manager would have to have a process for looking into that, and then maybe looking like, okay, well, let's change things. And what things can we change to help decrease the events? Maybe we need to, decrease the number of patients that are seen in a certain amount of time so that we can decrease our lost needle event rate. But that process that the manager uses in the safety world, especially healthcare safety, it's often called, the words that often get used to describe that are this plan, do, study, act process, or PDSA process. Okay. All right, safety categories and topics. So here's some of your CEU questions. So using the analogy in biology of taxonomy, I like to think of the categories as domains and the topics of kingdoms, because within each of these, there's lots of subtopics. So the 4 domains of safety are quality assurance, quality improvement processes, patient safety, and workplace safety. The 7 kingdoms of safety, or the 7 major topics that are covered, again, this is that CEU question. These are the topics that have been identified by the Safety and Practice Workgroup so far. Needle use safety, clinical care safety, personnel training, patient care, procedure safety checklists, workplace safety, Chinese herbal medicine, and safety issues in the healthcare system setting. And so I'm going to have slides for each of these 7 topics that identify some of the subtopics. And these are not all of the subtopics that the work group has identified. There's just some on each of the slides to kind of give you an idea of how broad safety is and how much safety affects so many different things. So this is just helping expand your idea of what safety is and how you can start if you don't yet know some of the terms for how to start talking about it, this will help you identify things that are related to safety and processes that are related to safety. And for time, because I am my time is showing me that I am getting close to my hour. I'm just going to kind of show you these slides, and then you can look at them in more depth when you're looking at the PDF. So needle safety, and then we've got number 2 on the list, clinical care safety. Both standard, so I think I mentioned here, standard precautions. So clinical care safety, standard precautions, transmission-based precautions. And these are some references for door signs. These are free from the CDC, just to give you an example of some of these things. Personnel training, everything from Bureau of Labor, I'm sorry, not Bureau of Labor Statistics. In this case, it's basic life support. BLS is basic life support in this instant. You know, CPR for the professional rescuer, mandatory reporting, and more. So much more here. Just a lot that are all related to safety. Patient care. So everything from documentation to medication safety, implicit bias awareness training, safety reporting, credentialing, and more. So procedures and SOPs, these are SOPs that are unique to acupuncturists that we pulled out. It's certainly not extensive or exhaustive. And acupuncturists do more than just this. These are just things that don't, most likely, if this is the first acupuncturist in the system, a lot of these procedures may be new to the hospital. Acupuncturists do more than just these techniques, but a lot of those more things are things that already probably won't be new to the hospital. But these are things that are often unique to acupuncturists. When you're writing, so some advice I wanted to pass on, when you're writing SOPs, I often see people try to get really detailed. And what I've learned with SOPs is you want to keep it simple and reference your sources that you're getting your information from for writing this SOP. So reference your sources, make sure they're cited, such as, you know, with needling procedures, you want to cite that clean needle technique. But the more detail you put in your SOP, the more troublesome it can be for compliance. So you want to make it general enough that it's going to easily fit more situations. If you're finding that you have to edit your SOP every week, it's not general enough. Or maybe your SOP is trying to cover too many things and you need to break that SOP into multiple SOPs. So you want it to cover most situations. And then when there's an exception, that exception shouldn't be happening like every day or every week. It should be more like once a quarter or even once a year or less. So if you constantly have to modify it, it's too detailed, make it general, or break that SOP into multiple SOPs. But most of the time, try to just make it more general so it applies to most situations. Workplace safety. In here, there's a lot, everything from OSHA to NIOSH to sexual assault, abuse reporting, workplace violence, workplace discrimination, and more. Yes, lots and lots more. Chinese herbal medicine and safety. This is still a new and developing thing, so resources are still being developed. One of the great resources that already exist in the community from community member Galina Rufiner, she has several training resources with continuing education credits available on Chinese herbal medicine. She got the program set up at Cleveland Clinic, and her resources about Chinese herbal medicine do have a really wonderful, strong emphasis on safety. So I have that link there. The work group has also identified the following patient populations, specialty patient populations and settings. This is what they've identified so far. These are settings and patient populations that are unique and need to be considered as a higher realm of safety. More stuff goes into this. These settings have higher morbidity and mortality associated with them. I did cut the example about how safety, quality assurance, and QI are related to documentation. We do have this resource just for time because we're short on time today. You can find this resource at the Hospital Handbook Project though. So speaking of where to find things, where to find safety and practice resources at the Hospital Handbook Project. So at the Hospital Handbook Project, this is the Hospital Safety and Practice Workgroup. This presentation is all about a lot of the work the Safety and Practice Workgroup has been doing this past year. The workgroup is working on a resource document that includes some of a lot of the information in the slides, plus a lot more information. So they're working on revisions right now, and hopefully it will be available on our website store when it will be available when it's finished on the website store, hopefully sometime this season. If you're interested in volunteering with the work group, that's cool. Send me a message on our website contact page about your interest. We do have, I mentioned the asynchronous discussion that's available to both Tier 1 and Tier 2 subscribers at the Hospital Handbook Project. We have two tags in the community, or in the community discussion. We have 2 topic tags for all the discussions and articles. So these are the 2 safety topic tags that we have in the community. And then when you follow them, it brings up everything that's related to that topic. And then I mentioned that past presentations on safety are available in our Issues in Hospital-Based Practice webinar series. The November one, if we are able to have a successful recording for that, it will also go in there. But November is coming. If you like the information here and you'd like to, remember the November session is a presentation, it's 2 hours, presentation plus community discussion. So if that's something that you're interested in, follow those links that I mentioned earlier for, on the Hospital Handbook Project website's event page to kind of learn about how you can join us live for that. So this is more recommended reading. Starting out with the scholarly publications and their links. I mentioned the CNT manual a few times. That's pretty important. The To Err is Human, that's from the Institute of Medicine, which became the National Academy of Medicine in their publication from 1999. Excuse me. And the National Academy of Medicine created a companion document in 2001 about crossing the quality chasm. So one of the authors of To Err is Human, Don Berwick, is also known for his work at the Institute for Healthcare Improvement and being one of the authors on the Triple Aim. So this Triple Aim concept in healthcare that was published in 2008. And the Triple Aim is care, health, and cost. So I included some ways for you guys to learn more about that. A quadruple aim is adding the provider burnout and resilience as an important factor. And all these things are related to safety. These are all related to safety. So these are not separate from safety. All these articles are related to safety. In 2022, IHI came out with the quintuple aim, which adds the 5th aim is health equity. And more about books. Most of the books on the new idea of safety in workplace, not just healthcare, but in workplaces in general, are by Todd Conklin and Sydney Decker. Podcast episodes that I recommend that just came out in September are Why a Culture of Patient Safety Matters. There's 2 parts to that. And then there's the Just Lead article from University Hospitals, and that talks about the University Hospital Safety Officer. It's an interview with him, Peter Provenos, and their program won the American Hospital Association's Quest for Quality Prize this past year. So they talk with him about his program, and one of the things he says near the end is, as he's talking about a lot of different things in a short amount of time, he talks about one of their programs was about leading with love and teaching about safety and transparency as as part of this larger concept of changing their healthcare culture. And there's one documentary that we're aware of so far. Okay, so these are some ways you can support the Hospital Handbook Project's work. And I thank you for your time today. So I hope you found some of the information here useful. And I enjoyed being able to talk with you today. I know I'm getting close to my time, so I enjoyed being able to talk with you today. If you have questions, please reach out and send me a message during October 6th through 8th. You can send me a message through the conference page. Yeah, there we go, the IM4US conference page. And, after the conference is over, if you want to reach me, go ahead and message me through the Hospital Handbook Project's website contact page. right, looking forward to hearing from you. And, just as a reminder, as you give me feedback, please know that that feedback helps us improve our resources at the work group. So as we're developing these safety and practices resources, as we're doing these presentations, the feedback that you give me help to improve our work for the next presentation, and as well as that any other communications that we're trying to put out. So I appreciate your feedback, and I hope you found some of this helpful. Take care.